Everyone at some point has turned up at their GP's rooms complaining of a frog in their throat. What a crazy idiom. I mean, have you ever wondered where it originated from? Legend has it that medieval physicians believed that the secretions of a frog could cure a cough if they were coated on the throat of the patient. I doubt there's any merit in that, but just the thought of having a frog put in my mouth would make me want to get better quickly. Speaking of secretions, you've got a runny nose, a cough and congestion, so have you caught a cold or is it an allergy? Unfortunately, it's often hard to tell, even for doctors. But it's important to know because you treat them differently. Colds are caused by many different contagious viruses that your immune system attacks. Allergies are caused by an overactive immune system that attacks harmless substances that your body mistakes for germs. So how do we tell them apart, Mike?
So you're absolutely right. So they do look very similar. And the things that they've got in common are the runny nose, and the sneezing and the feeling of congestion. But there are enough things that are different between coughs and colds and allergies that they can be told apart reliably. You just really need to know what to look for.
All right, so duration for me would be a big one, obviously.
Absolutely. So for a cough or a cold, usually they occur during winter and they last for anything between 3 days up to about 2 weeks. Unless, of course, it's a kid who's at creche, who's getting lots of infections again and again because they're getting the same viruses passed around between them. But that's different from allergies. Allergies can occur at different times of the year. If it's a seasonal allergen, it most often occurs during that particular allergy season. So if it's grass, it'll be during the duration of the grass season.
Which, by the way, in South Africa is a really long season.
Absolutely. It can be very, very long, up to 9 or 10 months. And that's different from the typical hay fever that you get in Europe, where they have a very short pollen season. But the other one that can be tricky is house dust mite allergy. And that is something that occurs throughout the year. And what's interesting about that allergy is because the house dust mite is living in your bed, it can be worse during the night time when the person is sleeping. And then when they get up and they start making their bed and moving things around, this plume of house dust mites comes out and they get symptoms every morning.
So coming back to the comparison between colds and allergies though, what about the onset of symptoms? Generally with allergies, you get exposed to that allergen, it's immediate. A cold has kind of got a prodrome, we call. Takes
Absolutely. So with cats, as we're saying, you pick up the cat, you get the symptoms. It happens immediately. With a cough or a cold, you tend to get a little bit of fever, a little bit of feeling bad. A sore throat, which is not very common with allergies, is a feature of coughs and colds. And then over the course of the next few days, you get progressively worse, and then it lasts until eventually it goes away.
What about body aches? So often when you get a cold, there's this general malaise. Body ache. You don't get that with an allergy, do you?
You don't tend to get it with allergy, but on the other hand, allergies can be quite severe. And if you're not sleeping at night because you're snoring and you're congested and you're not getting a good night's sleep, the next day you can feel very, very sleepy. Kids who have this problem have problems with concentration, and they go to school and they can't see what's going on because they may have problems with their eyes as well, with itchy eyes. And they often make funny noises, and they're fidgety, and they're falling asleep, and their teacher blames them for being a disruptive kid or says they've got ADHD or something else.
And meantime, it's just an allergy.
It's just an allergy.
Now, you see a lot of kids in your allergy clinic, and you can quite easily tell the difference between a cold and allergy based on certain signs that you see in children. What are those signs?
Many of them have got a long, narrow face. They've got a generally pale face with what we call allergic shyness, or dark eyes with lines under the eyes. They've also often got a ring around their mouth from licking their lips all the time. The thing is, if you can't breathe through your nose, you have to breathe through your mouth. That makes your lips dry, therefore they lick their lips, and that makes it more dry until eventually they get a dry, scaly area around their mouths.
What about that crease over the nose? That's a typical crease, eh? That sort of salute and...
Absolutely. So what they do is they get a permanent crease just over here where the cartilage meets the bone. And that's from doing one of two things. Either rubbing the nose like this just because it's itchy, or alternatively pushing it up like that, which is called the allergic salute. And it's a typical mannerism that you see in people with allergies.
The issue here is the difference between colds and allergies, because you've got to treat them slightly differently. I mean, there's some treatments that overlap, but what are the major treatment differences between the two?
Okay, the major treatment for a cough or a cold is to just take care of whatever symptoms that person has. You can't kill that virus, and you can't make it go away any faster than it's going to on its own. So what you need to do is you need to check, has the person got a bad headache or bad body pains, in which case they need painkillers. If they've got a sore throat, then something soothing for the throat, whether that's a old-fashioned remedy like using lemon tea with honey in it, which works very well, or one of the different medication drops, or
a frog. We talked about a frog earlier, having the secretions of a frog, but
secretions, I haven't heard of that one. Then if there's lots of congestion, the way to get rid of the congestion and the watery discharge is to use a decongestant nose spray, which will just dry everything up and open up those passages. Okay. With allergies, however, the treatment is slightly different. So you can use a decongestant nose spray, but not for long periods of time. It must never be used for more than about 7 to 10 days. Otherwise, what happens is that congestion comes back again. It's called rebound. It's called rebound. It comes back and it's really, really bad. So you can use those drops, but only for a short time period. But the treatment for allergies is really to identify the cause properly by going for allergy tests or finding somebody to do a really good history and avoiding that particular allergen. We don't recommend taking avoidance measures for absolutely everybody with allergies. You should find out what you're allergic to, and if you're allergic to that, then go to the effort and the energy of actually avoiding that particular thing.
Correct. So, Mike, we've talked decongestants, but what about more specific treatment for allergies?
Well, the most important treatments for allergies are to use antihistamines on one hand and to use steroid nasal sprays on the other hand. The antihistamines are usually better for treating the sneezing and the runny nose.
The symptomatology almost.
The symptoms that are coming out from it. But the advantage is that they work very quickly and they're very, very effective. And obviously they're a tablet. If, however, the hay fever is bad enough and doesn't respond to the antihistamines, we tend to go onto a nasal spray. And a nasal spray does contain steroids, not the ones that make you strong, but the one that damps down inflammation. And they get to the actual problem in the hay fever, which is the inflammation in the nose. And they're very good at working on reducing the blockage and the congestion with hay fever. The only problem with them, however, is that they take approximately a week or maybe two before they have a really, really good onset of activity. And for that reason, they need to be used regularly for long time periods. And then they're very, very effective.
Mike, thank you so much. We're going to leave it there. That's great insights again. We started out with the difference between colds and allergies. And though there are some differences, symptoms overlap quite a bit, as you've just heard. I think the most important difference is that colds don't last longer than 14 days. So if you still have symptoms after 2 weeks, then in all likelihood you're battling with an allergy. Go and see a doctor to sort it out soonest.